From the Department of Justice, Performance Standards for Juvenile Corrections with Edward Lochran and Kim Godfrey.
Good afternoon. Thank you. Since the opening of the Westboro Training School for boys in 1846, and it's actually about 20 miles from here, government has relied on the institution as the program of choice for juvenile offenders. The history of institutions reveals a cycle that has repeated itself generation after generation. When a facility opens, there's a period of calm when staff and youths interact and the youths actually make some progress. This is usually followed by overcrowding of the institution during a periodic crackdown on juvenile crime, and soon after, the living conditions begin to deteriorate. Older predatory youths begin to attack the younger, more vulnerable ones. There are increased escapes, youths assaulting staff, and then intimidated staff turn on the youths. Next follow exposure of the problems by the media, which usually triggers an investigation by state and federal authorities, followed by the appointment of a blue ribbon commission who issue a report with recommendations for change and improvements. Then the reforms are implemented, new monies are found to fix the problems, which usher in a new period of calm and order. This cycle continues right down to today. Performance-based standards is itself a cycle that breaks this destructive cycle. Let me give you a quick picture of the juvenile facilities. There are about 3,000 facilities for youths across the country with different degrees of security and staffing. There are almost 110,000 youths on a daily basis living in these facilities. Other than the employees and the volunteers, very few people know where these facilities are even located or what goes on behind the walls. About 10 years ago, the U.S. Department of Justice, Office of the Juvenile Justice and Delinquency Prevention, conducted a congressionally mandated study that found out some of what was going on in about 1,000 of the most secure of these facilities. And what they found out was not a pretty picture. Youth were getting hurt. They were not getting adequate physical or mental health care. There was a lot of suicidal behavior. There was significant staff turnover, and there was a high overrepresentation of minority youth in these facilities. OJJDP designed and launched a major project to develop and implement performance-based standards to lead the field out of this dismal situation and improve the conditions of confinement. OJJDP selected the Council of Juvenile Correctional Administrators, the organization of all state agencies responsible for juvenile corrections, to direct the project. This combination of federal-state leadership makes the potential impact for PBS huge. It is a program that can work in every state and facility across the country. From the material you've read, you can see that PBS has grown since 1985 to become quite an intricate system of data, technology, communication, consulting, and training. Essentially, the cycle has three parts: data collection, site reports and analysis, facility improvement planning, which is taking the data and turning it into an action and monitoring plan to demonstrate accountability and effectiveness. PBS works for states and government agencies because it gives them a roadmap to operate and manage while working to meet the highest of goals and standards. Let me give you just two quick examples. A facility's data shows that the number of youths receiving suicide screening within the first hour of admission has been dropping. 90% the last data collection, 70% this data collection. The facility managers and administrators have the information they need to make a quick and potentially life-saving decision to assure that youths are screened and that their problems are detected and handled immediately. On the other side, an agency may have developed and trained staff on de-escalation techniques to reduce the use of restraints because their PBS reports show that the use of restraints is way beyond the average of the other 125 facilities. Subsequent PBS site reports will tell them whether or not this new practice is working. However, the real significance of PBS is that for the first time, facilities and agencies are focusing on the quality of life issues that affect the confined youths.
I'd like to tell you about a 16-year-old named Scott who lived for 11 months at a PBS facility. This is one of many stories shared with me to help explain to you how PBS directly contributes to services for kids. By the time he got to the facility, he'd been in and out of community programs, unable to break his drug addiction and stop his illegal behavior. His mother died when he was 2. His father was working long, late hours. His school attendance and his grades were poor. The list of mental health problems was long. When he got to the facility, they did assessments of his medical, dental, and mental health, his social skills, physical fitness, and reading and math abilities. And this is what he was able to accomplish. He earned 9 credits toward high school. He completed an intensive 10-week program to change his behavior. He earned 244 positive awards, and he completed an outpatient drug and alcohol program. The case studies all show that if we can do this for one youth, it can be done to raise the quality of services at use at all 3,000 facilities, and that's our goal. Thank you.
Thank you. Question, David.
Do you have any plans for getting from a voluntary program in 115 sites to a mandatory program in 3,000?
We have plans. It remains as a voluntary program. And we are the contractors for the Justice Department. And I've talked to the head of OJJDP of how it may be mandated for the states. But there are so many facilities that want to join this project and so many state agencies that want to join the project voluntarily that we like proceeding in that direction. And we've been funded now $8 million for the last 9 years, which is unusual because most projects are funded for 3 years and they're out. But even this year, we received more than our usual funding because OJJDP really believes in this program. We also realize, though, that this is a real service to states, and the states need to invest in it themselves. And we have been talking to the member agencies of our CJCA organization, and most of them are willing to pay for the service, and we have costed it out, and new jurisdictions now will be asked to pay to reimburse our costs for delivering performance-based standards. So we think that voluntarily that the jurisdictions really want to do it, and they are willing to pay for it. And as budgets are beginning to turn around, I think it's going to be a lot easier for them to do that.
Ed Doran.
Help me understand the relationship between the standards you've developed and the behavior that causes outcomes to improve.
You mean the behavior of the youth?
Or no, the behavior of the folks who run these facilities.
Well, I think what it does is it sets some standards and some things that they can work toward, and we tell them, here's how you'll find out how you're doing, and here's some activities to do. What used to happen would be there's a facility, and they might know that they have some kids, for example, a teacher in a classroom, they would have a policy that says, we will provide education, but they didn't know if the kids are going to school, if the teachers were teaching according to curriculums, or if the kids are learning anything. So what this does is give them a way to really find out what's going on.
But is there some type of technical assistance that helps them figure out how to move from here to there?
We provide technical assistance to all the sites. In fact, we have a monthly distance learning call where the sites call in, and about 100 sites participate in the distance learning call, and we give them technical assistance. We also have site visits to them. The important thing here is that the administrator of the facility and the state agency is collecting data, and the incident reports are recorded and analyzed. And so therefore, staff that have a high rate of use of restraints, those staff now can be supervised. There are some, before this project, you could go into a facility and you don't know who's applying most of the restraint. It may be a brand new green staff, it may be a veteran who's a little burned out. They now have the data to analyze it, make some decisions about it, and then change behaviors.
Is this data public?
The data is public if the jurisdictions make it public. We have, so therefore, they, and many of them do, but it's not.
At what percentage of your jurisdictions do this?
What percentage of?
What percentage of the program is public?
Make it public?
Yes.
I don't know the percentage. Many of them actually use it when they go before their legislature or their executive branch to argue their budgets by showing what some of the problems are.
I'm just trying to determine whether the public, the parents who have juveniles who are in this system, can use it almost the way parents can use the 5-star rating system for daycare centers in North Carolina.
At this point, it is not public. When the project was developed, the sites were given the commitment from OJJDP of confidentiality of the data. Would you recommend it be public? I recommend that it be public. And we have talked to OJJDP about this information becoming public.
What about, is this applicable to regular prisons, adult prisons?
It is, and in fact, our counterpart, the Association of State Correctional Administrators, have had us speak to them many times. They are developing a set of performance-based standards for adult corrections comparable to what we've developed.
So it has a potential for over time.
It has a
Over
tremendous-
time, you could begin to really remedy and bring up to a standard or ensure that correctional facilities meet certain standards.
That's right, and I think one of the other advantages is we have a glossary of terms. An incident is, say, a restraint is a restraint in Michigan, in Arizona, or an isolation is an isolation in Arizona, Michigan, any other jurisdictions that are participating. The idea is that there's uniformity in definitions across sites. That is a great change from the past, that facilities were not being held accountable.
Ed Dorn, final question.
Do you have any sense of the cost ramifications of improving standards?
The cost of if that's your question, of a site to participate, the annual cost per facility is approximately $5,000. In terms of improving the conditions in the facility, it would depend on what the site report yields. So it may require excessive training, it may require additional staff, so those costs we would not know. But in terms of the participation, it would be about $4,000 to $5,000 a year per site, which my argument to them is right now state budgets for juvenile corrections is sometimes $500 million. And this is a very small investment to bring about quality improvement.
Thank you both.
Thank you.